Now for the second to the last region on the vertebrae that we're going to be discussing is the sacral region. So for the sacral region, what we got is the sacral region is usually fused. Like you have about 1 bone, 2 bone, 3 bone, 4, 5, but they are together. So collectively they can just say sacrum. But the sacrum is not only 1 bone. Do you understand? You have many bones coming together for that. So the sacrum, is, just so you know, is a large, it's a triangular bone at the base of the spine, and it's formed by the fusion of 5 sacral vertebrae. Okay, S1 to S5. So key features, you have the base, which is like the superior. Okay, articulate to the 5th lumbar vertebrae. Okay, at the lumbosacral joint. You have the apex, which is the downside. So the downside will now quickly join with the coccyx. Then you have the sacral foramina, openings where nerves and blood vessels will pass through. You have the median sacral crest, at the, should it be this? I think it should be this ones though. Then we have the auricular surface. Then we have the sacral canal, which is a continuation of the vertebral canal. So that's what we got. Beautiful things, beautiful anatomy. Function is actually to provide strong support for the spine and transfer weight, okay, from the thorax region and abdominal region down to the lower limb. So it forms the posterior wall of the pelvic cavity. It protects the sacral nerves and vessels. Serves as an attachment site for ligaments and muscles of the pelvis. So clinical notes is it could be affected by sacralization, where the lumbar vertebrae that is on top here, instead of being flexible at the lumbosacral junction, you are having a fusion there. So there's kind of like stiffness there. Okay, only the sacral bones are allowed to fuse. The lumbar bones are not allowed to fuse with the sacral bones. So you could also have issues of spinal bifida occluta occurring there. You can also have sacral fractures happening there. And if you want to give anesthesia, of course, you give it along this junction, which I think is between L4 and L5. I think it's S3 and S4 something. All right, so that's what we got for the sacral vertebrae.